Namaste. IJV Dr. Shaima Kadri from Faculty of Physiotherapy and Diagnostics. And today in this video, we are going to talk about wound infection. So let's begin with it. Infected wound. An infected wound is a localized defect or exacerbation of the skin on underlying soft tissue in which pathogenic organisms have invaded into viable tissue surrounding the wound. Infection of the wound triggers the body immune response, causing inflammation and tissue damage, as well as slowing of healing process. Many infections will be self-contained and resolve on their own, such as scratch or infected hair follicles. Other infections, it left untreated, if left untreated, can become more severe and require medical interventions. The skin is the body's first line of the defense, the surface of which is protected by a thin acid film produced by the sebaceous glands called as acid mantle. The acid mantle is a dynamic barrier and regulates the skin's pH and maintain microorganisms called the normal flora that help prevent pathogens from entering the body. Pathogens will often displace some of the normal flora and colonize contained locations. But most of the time, this does not lead to infection and does not stimulate an immune response. However, when the skin is broken or if the immune system becomes compressed, any of the microorganisms colonizing the skin or introduced to the wound can cause an infection. The microorganism likely to infected a wound depend predominantly on what microorganisms are present on the skin, as well as the depth and location of the wound. So, what are the symptoms of an infected wound? We can say the clinical representation of the infected wound include fever, erythema, edema, induration, increased pain, and change in drainage to a plurulent nature. However, symptoms of infection is chronic wound or debilitated patient may be more difficult in discerning in their cases. Diagnosis may be rarely or non-specific symptoms such as loss of appetite, malaise, or decrease in glycemic control in diabetics. You can see if there is infection, there are maybe the chances of amputation. If you talk about the etiology, so the most infected wounds are caused by bacterial colonization, originating either from the normal flora on the skin or bacteria from other parts of the body or the outside environment. The most common infection causing bacteria is Streptococcus aureus, and other types are streptococci. The risk factors are poor circulation, diabetes, obesity, compromised or suppressed immune system, decreased mobility or immobility, malnutrition, poor hygiene. Complications are the complications of infected wound can vary in range from local to systemic. The most severe local complication of an infected wound is stalled wound healing, resulting in a non-healing wound. This often results in significant pain, discomfort, and psychological determinant for the patient. Systemic complications can include cellulitis, that means bacterial infection of the derma or subcutaneous layer of the skin, osteomyelitis, that means bacterial infection of the bone or bone marrow, or septicemia, which means bacterial presence in the blood and can lead to a whole body inflammatory stage. The diagnosis is bacterial culture, gram strain, antimicrobial susceptibility, fungal culture, blood culture. Treat- Treatment is the precaution can help minimize the risk of the developing infected wound in at-risk patient and to minimize complication in patient already exhibiting symptoms. So, prompted the proper wound cleaning and reduce bioburden, maintaining proper nutrition and hydration. Approaches to a treatment can be broken down by whether the infection is systematic or localized just to the wound area. Systemic treatment often will call for oral antibiotics, the specific type determined by microbiological interventions, investigations, and local infections control protocols. Localized infections can be often treated by topical antibiotics, drainage or debridement may be necessary to remove slow and device tissue, or these slow wound healing and can affect the efficiency of topical antibiotics. Antimicrobial dressing, including those that use silver technology, may be used to help reduce bioburden. Antibiotics, whether topical or systemic, should only be only under the expediting direction of the physician. So this was all about the wound infection. If we are talk about the prevention of the wound infection, so if if the we does the prevention in surgical wound, the operation and surgical team may strict procedure to try to help and avoid infections. Surgical infections are monitored by public health so that policy can be changed and improved if needed. There are a number of things to do the wound infection prevent. There are as follow. How a shower or a bath done by the patient operation and wash patient with the soap and water. Do not use the razor to save the area of operated on and make infection more likely if the hair needs to be removed. You need to tell patient about to do these things for prevention. Tell patient to remove all the jewelry and nail polish before the operation. Keep the wound covered and the area around it clean. Patient can shower from 2 days after most operations. If patient notice the skin around the wound becoming red or painful, you need to ask any health person. Preventing infection in wound from injuries. So it can be clean the wound. You need to ask patient to clean the wound skin around to it, and as soon as it happens, use cool boiled water or drinking quality water. If patient thinks that there are still bits of foreign bodies in the wound, um, need to check up. If patient if it patient have a deep wound or on the edges are very far apart, patient can stop the bleeding, and patient cannot stop the bleeding. Patient can take the help of the medical person. Use antiseptic around the wound area to help keep the germs away. Put a clean design dressing over the wound to protect from germs. Do not use gauze or type of dressing which will stick to the wound. Bites are very likely to become infected. See medical advice at the earlier sign of this. If injury is large or there are multiple bite wounds, it may be wound having antibiotic in case sick advice. Keep a close eye on the wound and arrange for our tetanus vaccination. So this was all about the wound infection. If you have any queries related this video, ask me in comment section. This video is powered by Jyoti Vidyapeeth Women's University Digital Version 2.2. खुश रहिए नमस्ते